Side of the ankle joint. First we'll write the outline of the foot. The outline of the foot that we are writing with this intact skin we are writing. Then we are writing the distal and the proximal phalanx, the first metatarsal bone, medial cuneiform bone, and the navicular bone. All these are the bones that together are called as tarsal bones. Then we are writing the largest tarsal bone, that is calcaneum. We'll label each of them. The distal phalanx, the first metatarsal bone, proximal phalanges or phalanx, distal phalanx, medial cuneiform, the medial cuneiform bone. So we got three cuneiform: medial, intermediate, and lateral. This we are writing only the medial cuneiform. Then is the navicular bone, then calcaneum. So all these are the tarsal bones that are need to be written. Then we are writing the part of the tibia, that is medial malleolus. So all these are bony outlines that need to be drawn before drawing the soft tissue. Soft tissue includes the bones, blood vessels, whatever it is. So this is how exactly. This is anterior, the posterior, superior, and inferior. We'll label it. Next we'll take a different sketch pens which helps in drawing different soft tissues. We'll be taking brown sketch pen to color or to draw muscles. So mainly there are three muscles: flexor hallucis longus, tibialis posterior, and flexor digitorum longus. We need to write with this brown color thing, so that is flexor hallucis longus I'm writing. So we'll start from the distal phalanges, that is flexor hallucis longus. Flexor hallucis longus. We'll label it flexor hallucis longus. Flexor hallucis longus. That is from the distal phalanges, flexor hallucis longus. Write the dotted lines. I'll tell you why to write dotted lines. Flexor hallucis longus. Flexor hallucis, we label it. Next we'll go to one more muscle, that is tibialis posterior, that is to the navicular bone. What is that? The tibialis posterior muscle. The tibialis posterior, we will label it the tibialis posterior muscle. The tibialis posterior muscle. This muscle is present just posterior to the tibia, tibialis posterior. So we have written two muscles: tibialis posterior, flexor hallucis longus. Next we are writing flexor digitorum longus. Flexor digitorum. See carefully, observe carefully how we have to write flexor digitorum longus. Flexor digitorum longus. Flexor, we will label it again, flexor digitorum longus. Flexor hallucis longus and flexor digitorum longus. So all these are three muscles that pass deep to flexor retinaculum. Deep to flexor retinaculum. Hallucis, distal phalanx, proximal phalanx, first metatarsal bone, medial cuneiform bone, navicular bone. This is navicular bone. Next we are writing a red color sketch pen. We are taking and writing an artery, that is posterior tibial artery. Posterior tibial artery we are writing, which divides deep flexor retinaculum into medial and lateral plantar arteries. So we label posterior tibial artery, the posterior tibial artery. Next we can see that getting divided into two arteries, that is the medial and the lateral plantar arteries. Lateral plantar arteries. Medial and the lateral plantar arteries. Which one? The posterior tibial artery divides into medial and lateral plantar arteries. Next we'll take yellow color sketch pen for the nerves. That is the tibial nerve. We are writing which nerve? The tibial nerve, which divides into medial and lateral plantar nerve. Tibial nerve divides into medial and the lateral plantar nerve. The terminal branches of tibial nerve, that is medial and lateral plantar nerve. So we label that medial and lateral plantar nerves. Medial and lateral plantar nerves. These two are terminal branches of tibial nerve. Now we'll finally take green color sketch pen, that is for the retinaculum, the flexor retinaculum, and draw in such a way that anterior end is attached to medial malleolus, the posterior end is attached to medial tubercle of calcaneum. We label it as flexor retinaculum. The flexor retinaculum. Flexor retinaculum. We'll write the subheading for this diagram. Usually it comes for short notes, that is for 5 marks. The flexor retinaculum. So all these things you should draw if they ask. We'll understand that deep to retinaculum there are 4 compartments. From anterior to posterior, a code is there, that is Tom, Dick and Harry. Tom, Dick and A-N. Harry, H. Only first letter of Tom, Dick and Harry will take. Third, fourth and fifth, and first letter of Harry. So A for artery. Which artery? The posterior tibial artery. The posterior tibial artery. Posterior tibial artery. Now a tibial nerve. N for now, that is the tibial nerve. T for tibialis posterior. Tibialis posterior. D for flexor digitorum longus. The flexor digitorum longus. So tibialis posterior comes anteriorly, then flexor digitorum longus. D for digitorum. So I am writing flexor digitorum longus. The last muscle, that is H for H, that is flexor hallucis longus. Flexor hallucis longus. So all these are structures that are present from anterior to posterior end deep to flexor retinaculum. Flexor hallucis, hallux means the great toe. This tendon has infection of the great toe, so it is called flexor hallucis longus. This is how you need to write the attachment structures deep to retinaculum. The artery and nerve has a single compartment, that is the third compartment. All other three muscles are in separate compartments. So there are totally four compartments under flexor retinaculum. We label the subheading, usually comes for short notes or 5 marks question.